to Watch is an intimate look into the lives of prominent and influential women leaders from around the world and the challenges they faced on their journey. It's the real story behind her title. Join us every week to hear more stories about women from around the world and in your own communities at womentowatch.net. Hello, everyone, and welcome back to another week of Women to Watch. I'm Sue Rocco. Thanks so much for being with me. Joining me in just a moment will be Dr. Resa Lewiss. And Dr. Lewiss is a professor in emergency medicine with a specialty in ultrasound. And she's doing a lot of great work in the medical field and also just launched her own podcast. So we'll be learning more about that. Stay with us during the breaks where you'll hear from our exclusive watch team of corporate partners, bringing you some great news and inspiration from their fields. And please be sure to subscribe to the show on YouTube at W2W Media. So now I'm very excited and honored to welcome to the show Dr. Resa Lewiss. Resa, welcome to the show.
Thank you so much for having me. It's fantastic to be with you.
I'm very excited to have you. And we connected quite a while ago, so I feel like we've been waiting for this conversation for quite some time. So I'm very happy to have you. And where are you joining us today? You're in Philadelphia, right?
I'm here in Philadelphia, yes.
So listen, I want to dive right in and learn about your background and share a little bit more about where you came from and some of the things that impacted you when you were young and led to the work you're doing today. So talk a little bit first about Westerly, Rhode Island, which I had never heard of. I looked it up. It looks like a beautiful place on the coast to grow up. But tell our audience a little bit about that town.
Sure, and thanks so much for the question. Westerly, Rhode Island is the southwesternmost town in Rhode Island, right on the Connecticut border. It is a beach town right on the Atlantic Ocean. So the population is about 20,000 people, and that population doubles in the summertime. Many people have summer homes or come for the beaches. I was born there. My father was born there. My grandfather was born there. And my sister has children. Her children were born there. And I would say you could characterize it as just like many small towns. People don't necessarily stray far. And there's a lot of community, a lot of family. And you get all the positives of a small town and sometimes the learning lessons or maybe challenges of a small town. I went to the public high school there, Westerly High School. And after high school, I actually stayed in state for college. I attended Brown University, which is about as far away in the state of Rhode Island and still be in the state. So it was about 45, 50 minutes away.
Yeah, it's just such a beautiful part of the country. So one of the things that you shared with me when we had a conversation earlier was that the expectations for you growing up, you have a sister and a brother, and they were quite different for you and your sister than they were for your brother. So describe what you mean by that.
That's right. I would say that my parents had very traditional gender expectations of their children and very clear boys do this and girls do that. And that manifested, for example, in chores we did around the house, that manifested in after school activities, and even in academic ambitions, I would say.
And one of the things I admire about you in really learning your full story is that you were not going to accept these limitations. And you absolutely, at a very young age, pushed back. In what way? How did you push back? Was it verbally? Was it through action? Was it both?
You know, from a very early age, these sort of traditional expectations rubbed me the wrong way. They just didn't sit right with me. And I think because I saw a lot of equity, I saw a lot of lack of equity, and I felt that lack of equity, and it didn't feel fair and it didn't feel right. So a story I famously share would be dinner and dinner time. we would sit down as a family at 6 p.m. for dinner during the week. And dinner would end, and my father would look at me and my sister and say, "Okay, girls, help your mother clear the table." And without fail, I would push back. I would say, "Dad, why do we have to help clear the dishes? How about everybody clears their own dish?" And he would say, "Resa, help your mother clear the table." And I'd say, "Well, what does he do?" Meaning my brother. And he'd say, "Well, he takes out the garbage." And I would say, "Well, I prefer to take out the garbage. How about he clears the dishes and I take out the garbage?" And I had no idea why this really bothered me so much, except the fact that I didn't think that there were any activities around the home that should be based on, your gender. And it turns out years later, I found this amazing book called Women Don't Ask: Negotiation and the Gender Divide. And almost that example was perfectly described by the authors. And it really explained why that rubbed me wrong. So, in traditional households, and I'll say every household's a little different, but this is what was happening in my household. Um, tasks that promote dependence are often assigned to girls. So, for example, doing the laundry, taking out dishes, filling the dishwasher, things that were sort of a routine part of the house that were required on a daily basis. Those promoted dependence and often were not acknowledged or rewarded, versus these other tasks around the house, for example, taking out the garbage or mowing the lawn or shoveling snow. Those promoted independence, and often you could get rewarded. You could actually, for example, go around to neighbors and ask if they'd like to pay you, and you would shovel their driveway or mow their lawn. And that's exactly what I tuned in on without even knowing why, but something about it very much bothered me.
Yeah. So, it's interesting the piece that you pushed back, because I think it's a pretty common story to certainly generations prior to our children, for that kind of an upbringing and a family dynamic. And often, if that's what you just do it. The girls play the role of what the father expects of the girls in that house, and the wife and the mother. Um, and you just didn't. You pushed back, and I wonder if you were you would you say you were born with that challenging trait,
So
or was there an experience that had you question it?
it was always in me. And I think what I saw, my mom stayed at home with us. She had trained as an elementary school teacher. And then once she and my father had children, had us, she was at home with us. And my father uh, left the home every day and was the one working out in the world and doing things out in the world. And I don't know if it's because I'm an Aquarius and Aquarians are supposedly independent.
Oh,
I wanted that sense of independence. I saw freedom, I saw choice, I saw adventure, I saw learning, and I didn't want a small world. I wanted a big world. And that even manifested, um the hope was that I would do dance classes and ballet classes because that's what girls did. But I actually really preferred to be out on the sports field, like playing baseball, playing soccer, playing tennis. And that's really what I um, spent most of my extracurricular activities doing, was sports.
yeah. By the way, playing on a boys' baseball team.
That is right.
Well, that's gutsy.
Yeah, I was super excited. Played first base, which, you have to be pretty good to play first base. I routinely hit home runs, and I loved it. I loved it.
Yeah, yeah. One of the other things you shared with me, I just thought it was very interesting. When we kind of analyze, our families and why we are the way we are, we look to our parents. Where did they come from? What was their messaging? What happened in their life? And you said that you just believe your mom and dad were acting often from a place of fear, right? Rather than just having that same curiosity for life, I'll say. Why do you think that is?
Yeah.
What was it about? Yeah.
It's an insightful question. And, as an emergency physician, We actually take care of patients that come in with trauma. And equally, we are witnesses to traumatic um, sort of presentations of the patient and, people that have been very badly injured. And, often we are there at the time that people are passing, they are dying. And so there is this exposure to trauma. And as I've thought deeper and deeper about this exposure to trauma, and I do believe in this concept of inherited and generational trauma. When I look at my parents, both of them had their own parents die at a young age. So my father had his mother die when he was a teen, and my mother, both of her parents died in her early 20s. And I think that deeply affected them and affected the way they parented. And I think I do think there was a lot of fear and keeping children safe, and this extra element of like girls need to be kept safer even more so, and you need to be even more careful than perhaps you are with boys.
Mm. Yeah, it's very interesting. I want to share, and I'm going to read this because it's a lot, all of the education you have had. So you've earned degrees from Brown University, the University of Pennsylvania School of Medicine, NIH Howard Hughes Research Scholars Program, Harvard Emergency Medicine, and Mount Sinai St. Luke's Roosevelt. Obviously, you love learning. You wouldn't be doing and pursuing all of those degrees. Are there any degrees left that you have an interest in pursuing?
I love this question. I have thought many, many times about getting other additional degrees. I've thought about going deeper into many interests. I describe myself as a liberal arts geek in that I love learning about many, many topics because I believe adjacent areas, unrelated areas help you be an even better, more focused, more astute person in whatever your main area of subject matter expertise is. And I think you can have more than one subject matter expertise. So, I've thought about rounding out some of my education with more on business and economics. I've thought about, where I am now in my clinical practice, adding on a prevention and nutrition component. It sounds a bit odd that physicians don't learn about nutrition and food. And there's a huge movement now, something called food is medicine. And that, if you adhere to and follow simple rules regarding diet, that can play a very impressive scientific evidence-based role in preventing, treating, and reversing some of the chronic diseases that we see in this country, such as diabetes, cancer, obesity, and cardiovascular disease.
Risa, that's really interesting. You would think that part of the curriculum and education for anybody going into medicine would be classes on health, nutrition, exercise, which I think we can all say for sure has an effect on our overall health. And so
Yeah.
perhaps, I mean, wouldn't you say that physicians in general are accepting this holistic philosophy for treatment?
I think it really depends. And I think, people would suppose that actually physicians are very, very good at taking care of themselves. But I would posit, I want to use that word right there, I would posit that we're really good at taking care of other people, but we're actually not particularly good at taking care of ourselves. And as you know, we recently published a book, and our chapter one is actually MicroSkills for self care because it's not just healthcare, it's not just doctors. Almost every industry does not model um, loud and actually really expect people, adults, to take care of their own health. And I really feel that everything starts with the self. So you actually have to take care of your health. Circling back to food and nutrition, it's a bit late to the game, but I think it's because the US healthcare system is built on, a lot of people don't jokingly say it's a healthcare system, they say it's a sick care system. What is reimbursed, because dollars very much drive the US healthcare system, is once people are sick, once there are medicines to prescribe, once there are treatments to apply to the patient. But prevention, which in this case would be food, diet, exercise, sleep, avoiding nicotine, things like this, that is not as emphasized and we're not as educated on it as we should be.
Yeah. Can I ask you, what do you do, just your daily routine or weekly routine to pay attention to that, to health and
Yeah.
wellness for yourself?
So I'll just say that I believe I'm a bit of a, um, I have friends who are like me, but I would say I'm not the norm. I actually take my health and wellness very, very seriously. I, um, follow a vegetarian, vegan diet, so mostly plant based. I try to move, exercise every single day. Right now, that's comprised mostly of yoga, meditation, and walking. Um, I'm not an alcohol drinker. I'm not a tobacco smoker. I really subscribe to this concept of being in community. So I try to really, have close people in my life with whom I get together and speak with regularly. I was very, very slow to the sleep is health movement. I did choose emergency medicine after all, which basically means you are up at many different hours, you have shifts at different hours, and you switch a lot. And I used to really think that I didn't need a lot of sleep and that actually the more I worked, the more productive I could be. So you started by naming all these degrees, and I really I had subscribed to the work 12 hours a day. I don't need to sleep. And the more I worked, the more I would get done. And I really, really um, reversed that mindset. I actually think
Mhm.
just like we can have deliberate practice, deliberate work, we need to have deliberate rest. And that deliberate rest is sure sleep. It can also mean taking naps, the exercise, having conversations with friends, reading books, not for work, but for pleasure, and other things
Mhm.
such as this. I really believe in the importance for health. And also, by the way, that helps you be more productive when you sit down to focus on your work.
Yeah, I would imagine though that you have boundless energy because of the very healthy lifestyle you live. So you're not feeling tired and, lethargic most of the time is my guess.
Yeah, I mean,
What
it's taken a while to fine-tune these routines and, I definitely am human and everything is not strict every day, but I really believe in it. I read these books on leadership and on productivity and efficiency and on health, and once you see the same thing on many, many pages of many, many books, it kind of sticks, and I subscribe to these practices.
Yeah. How did you, I don't know if we ever talked about this. How did you land on emergency medicine
Yeah.
out of all the things you could do? I mean, to me, that's one of the scariest places to be.
Yeah. Going back where we started, no one in my family is a physician, and there was not an expectation that I was going to be a professional, but it was always in me. I knew I wanted to be a physician. I remember in the 6th grade memorizing all the bones of the body and loving it. And I also remember we did this science experiment in that same science class where we were supposed to bring in baby teeth that had fallen out, and we put them in a cup of soda. And from one day to the next, those teeth had rotted. And I was so impressed with what soda did that, right there at the age of 12, I stopped drinking soda.
Wow. You're very
And
disciplined.
yeah. My father would also tell a story. He was a cigarette smoker actually for the elementary school years of my life, and I don't know why. I used to actually take his packs of cigarette and I would soak them in water and or break the cigarettes to try to make him stop. And I just again, it's always in me. It was always been in me. So fast forwarding to becoming a professional, there was no expectation that I would be a doctor. And when I got to med school, I was amazed. I was like, this is amazing. I cannot believe I'm being given this much responsibility. I get to learn the body, all this. I was psyched. And I did go in not knowing what field I would pursue. And I was actually a bit stressed because every rotation I did, everything was okay. I liked it, but I didn't love it. And I really felt that to pursue a specialty as my calling, I had to have that gut feeling of love. Now, I really did like the surgical specialties. And so I actually really thought I was going to be an ear, nose, and throat surgeon. I took a year off and did a year of research at the NIH, as you shared. And when I came back, I thought, I need to get back into this clinical mindset. And I did have the feeling that I really liked ENT, but I didn't love it. And I didn't like that feeling because I felt, you need to love this, Resa. Like, you're going to be in the operating room. This is a lifetime of a decision. And I did a first rotation back in emergency medicine. I thought, where have I been? This is it.
Oh,
I get to
yeah,
see men and women and babies and elderly, and I get to do little procedures, but not procedures that take me to the operating room. And I felt very practical, and I felt that actually it was a specialty where I could help many people, colleagues, yes, but actually friends and family. It was always on my mind that wanted to be the person that when people called me, I could help. And emergency medicine was a great specialty for this.
yeah. And you obviously have I'm not sure the word I'm looking for, but emergency. It's a time that is highly stressful. Most medicine is, but I mean, there's an urgency. That's the
Hmm.
word.
Hmm.
And you have such a calming energy. You have such a calming demeanor. I'm not surprised you do yoga. So I would imagine that that is very helpful and critical to be, in those instances and be able to stay focused in the moment.
Yeah, I have a funny story. A friend was visiting me one time, and there was um, an oven, one of those countertop ovens, and it caught fire. And I was in another room, and she said, "Resa, like, it caught on fire. The appliance caught on fire." I said, "Okay, just unplug it. I'll be over in a minute." And she was just like, she couldn't believe that I was just like, step one, step two. I mean, part of it
You
is, I
didn't
think.
freak out. You didn't freak out like most people.
Exactly. I mean, I think you come to these professions for a reason in terms of your personality, but I think also the specialty and the training cultivates that. There are people that model that, and you decide, oh, I'd like to react in that way. I'd like to not react in that way. Or you learn what is effective to be able to think clearly. I always knew that if I panicked, or if I stressed, I wasn't thinking as clearly as when I was calm and took 2 deep breaths first.
Yeah. Maybe you should teach how to do that. That'll be your next thing to do. Listen, we're going to go into our first break. And when we come back, I want to talk about ultrasound and, what you're working on and what you're hopeful for, and share some of the things with our listeners and viewers that are exciting around that. Stay with us for our watch team, and we'll be right back with Dr. Resa Lewiss.
Hi, my name is Christy McCaffrey, and I'm the founder and owner of Be the Good Media. Today, I'm here to share some good news with you. I wanted to share with you about a guest I had on my podcast named Julie Anderson. Julie is the CEO of a global organization called Plastic Oceans International. This organization's goal is to end plastic pollution and to foster sustainable communities worldwide. What inspired me most about my conversation with Julie is that she really leads from a place of her own passion to support environmental and human health and her love for the ocean. There's nothing more inspiring to me than to see a woman at the head of an organization doing something that she's just so passionate about, and they're clearly making a difference globally. To hear more of our conversation, you can visit bethegoodmedia.com. And there you'll also learn more about how Be the Good Media works to amplify impact-driven missions and causes. Again, I'm Christy McCaffrey. Listen here for more good news on Women to Watch.
Hi, I'm Dawn Zier, CEO, Board Director, and Executive Mentor to Fortune 500 executives through my work at the Exco Group, a firm of experienced CEOs, board directors, and global business leaders who offer real-world experience to help organizations and senior executives grow. Today on Leadership Watch, we're going to talk about the importance of being purposefully intentional. A career is not a straight line, but each stop along the way should be well thought out and provide a path for future opportunities. Here are 4 ways to be intentional about your career. 1. Tell your story. Create your elevator speech, practice it, and be ready to share it. It's much more memorable and effective than just listing off your accomplishments one by one. 2. Develop your personal brand and know what you stand for. Jeff Bezos once said, "Your brand is what other people say about you when you're not in the room." Your personal brand encompasses your core values, how you show up, the way you treat others, your online presence, and the list goes on and on. Think about what you want to be known for, be intentional in how you present yourself, and figure out what makes you unique. 3. Be intentional with your career moves. A career is not always about moving up. A lot can be learned from lateral moves, but have a clear reason and objective for each move you make. And finally, be direct with your communication. Know your desired outcome when having those important conversations and be deliberate with your messaging. Be intentional around the position you're taking, communicate the why, seek buy-in, and remember that how you get things done really does matter. Please follow me on LinkedIn at Dawn Zier. Also, if you're a senior executive looking to grow in your career, visit excoleadership.com.
Welcome back to the show. I'm joined this week by Dr. Resa Lewiss. And Resa is a professor of emergency medicine with a specialty in ultrasound. And just before the break, I mentioned that. And I think what you're doing is really exciting. And maybe you can just describe for our audience what work you are focused on pertaining to ultrasound.
Sure. So I pursued emergency medicine, and truth be told, I actually never learned ultrasound during my training. However, in my final years, the specialty training for emergency medicine is 4 years. There were 3 absolutely instrumental people in my life who are still loved and dear people in my life, and they were using this technology called ultrasound. And in all 3 cases, the common theme is, number one, they were very good to me. They're mentors to me. They're coaches to me. They're dear friends. But also, they had all learned about ultrasound and utilized it for better patient care in remote circumstances. In one friend's case, he trained in LA in a county hospital with limited resources, and he was using ultrasound to help make patient care decisions. The next friend did disaster medicine and global health work. And so in times of the disaster, she was able to use like a portable machine to help make decisions. Finally, the third friend used it in rural settings here in the United States, as well as global health missions in Africa. And all 3 of them are good people, excellent clinicians, excellent physicians with really a patient centered focus to their care. So I really was like, what is this technology? Finally, when I finished training, before moving to New York City to learn ultrasound, I was working in a community hospital for about 9 months. And overnight, there was no ultrasound services, so I couldn't get an ultrasound. And a colleague was working, and he did learn ultrasound in his training, and he was able to make a patient care decision. I think the patient had a gallbladder infection, like acute cholecystitis. And I was really impressed that he could make that using this, at the time, this very, very big machine. So the opportunity came up to do a fellowship, and literally one of those 3 that I mentioned that used ultrasound said to me, Resa Lewiss, why are you going to do another year of training? Ultrasound has never gone anywhere. It's not going to go anywhere. Now, this was in 2002.
Wow.
And he has since circled back and he said, Resa, I was wrong. I was wrong. Because for what it's worth, ultrasound, the use of ultrasound at the bedside, and the terms in emergency medicine that we use, sometimes it's called clinical ultrasound, emergency ultrasound, bedside ultrasound, point of care ultrasound, because we're performing it at the point of care of the patient. That's all designated as different than the ultrasound that people think of when you go to the radiology suite. So all of a sudden in emergency medicine, it took off. And there were maybe 5 fellowships at the time in the country. Now there are close to 100. Also, it became actually so, the evidence was so there to support patient safety, better decision making, improving the lives of patients, that it became a requisite part of emergency medicine training. So when I graduated, I didn't need to learn ultrasound. Now, an emergency medicine resident cannot graduate residency without learning and showing proficiency in ultrasound. So it really took me many places as a medical educator, as a researcher writing papers, and also another way that I think I'm different. A lot of American college students, they do their semester abroad, but I quite honestly loved college so much that I did not want to miss a semester off campus. And I think I wasn't ready, having grown up in that small town, and a little bit of that fear factor had gotten under my skin, that I wasn't ready to be out in the world in that way. But, by this point, I had experienced quite a few cities. I actually love cities. And I was ready to start seeing the world. And I saw the world through training ultrasound and working with other medical practitioners, midwives, nurses, physicians in many different countries, all with the goal of creating sustainable programs. So I was going training people, the actual, healthcare practitioners, to then I could leave and they can use ultrasound for better patient care. And in many instances, it was because they too had limited resources. They didn't have a CT scanner or an MRI readily available. So it really played a role in better patient care for them.
Yeah, wow. The only thing I think of when I hear ultrasound is babies
Right.
going to that
Right.
ultrasound. And I really didn't, know that it could be utilized for all these different reasons.
Yeah.
Um, so I want to talk about, well, first of all, you decided to start your own podcast. So let's talk about visible voices. Yes,
hmm
the podcast. Why did you decide to add that to your plate of things to do? And what's it all about?
Uh, I'm so glad you asked me about the podcast. So, you know, I even maybe tag this back to childhood and growing up and loving sports and sports announcing. I was asked by the Westerly cable TV, I think it was, to help be a sportscaster for football games. So I did a few games and I didn't really even know what I was talking about, but it was such a compliment to be asked. I was sitting with these two men and I don't even remember their names, but they invited me to sportscast with them at, the high school football games. And so maybe that was a little bit of an exposure. Also, I've always felt much more comfortable expressing myself verbally, like speaking more than writing, although that has, now flipped 180. And when it came to podcasts, my first podcast was an ultrasound podcast that I became aware of. And during the pandemic, I thought, just like many of us in healthcare, I want to make a difference. I want to start contributing. And I was trying to figure out different ways to contribute. One was I started writing. Also, though, I had been a guest host on different podcasts. And it was a combination of, number one, I really enjoyed it. I loved the conversations and I loved creating themes of the different guests that I would invite. And I got very positive feedback about my ability to host and moderate and conduct a conversation and interview. So I thought it's time. And it took a while to figure out the title, The Visible Voices. And it has to do with circling back to equity. I have definitely seen both in medical training on the doctor side, I'll say, because that was my experience, but also on the patient care side, the lack of equity. And if we focus on physicians and who is thought of as the subject matter expert, who's tapped to give the grand rounds talk, who still, makes a higher salary for the same job that, say, women are working, it's often the same demographic. It's often elder white men. And yet, I know many, many people that are subject matter experts that are doing amazing work, but they're not often tapped to be the ones to speak. So my goal was to elevate, amplify voices, people who are just doing amazing things in healthcare, in equity, and then I also say the category of current trends, which goes back to me being that geeky liberal arts student. Topics such as other books, documentary films, and just, interesting things. But, it's actually generally not hard to tie things back to healthcare and equity. And, it just resonates very deeply with who I am and with what I think is important and with topics that I think should be of interest, or the, lay people or general public might be interested in learning.
Yeah. Well, I love the idea of giving voice to those who are not the most notable, the ones that are heard from all of the time, frankly, So new voices, I think those stories are often much more interesting. Um,
100%.
yeah. So let's talk about your book
Mm.
also. You wrote a book recently. It was just published in April, am I
In
right, of
April.
2024?
Yeah.
MicroSkills, Small Actions, Big Impact. Um, to provide people, this was an interesting take on, I asked you why, and you got off on a tangent about wanting to help people to have that sense of belonging. And in order to do that, they need the skills to be able to manage the professions and the places and the cultures that they're in. So describe that, the book a little bit. And again, that decision to write a book, it's a big undertaking. It's a big project.
Yeah, and this ties into some of the threads that we've talked about so far in terms of equity, in terms of belonging, in terms of figuring out and forging a path that maybe wasn't the path expected of me. And I have always been a reader, and a friend of mine one time said about reading oneself out of one's deficiencies, and that you can always read about things. And in this day and age, you can actually YouTube about many things. There's so many
Right.
access points to learn, and I love learning. And again, because I feel like it can only make me a better person, a better thinker, a better subject matter expert, no matter what the subject matter is. And so I had, for a long time, read books about leadership, about communication, about managing people, because I was increasingly in these roles. And I had some successes, but I definitely had some kerfuffles. And I wanted to use that word right there, kerfuffles, where I could have done better, or I wanted to become better because it didn't fall well for me and fall well for the other person in the case of, for example, a difficult conversation. And I found myself also reading articles like Harvard Business Review articles and Fast Company articles. And I think hopefully less so now, but many people think there's all these industries and workplace sectors, and then off to the side, siloed off, is healthcare and medicine. And the truth is, it's actually just like many workplaces. Patients are clients. We get evaluated. We have a return on investment, and hospitals are always sort of trying to, adjust their margins. So it's actually some of the same language, same things. It's just people think it's different because, well, doctors aren't supposed to be, but really healthcare is a business just like any other business. So what I found is many of these books are not written with everybody in mind, but everybody thinks they're written as if everybody is in mind. One example I'll give: when I finished all that training, I had quite a bit of debt, and no one had ever taught me about finances. And I'll go back to actually the childhood, like boys were supposed to learn about finances and money, but not girls. And so I, was like, okay, it's time to read. And I opened and closed quite a few books. Very few spoke to me because they made so many assumptions. And, finally I did find a book that spoke to me because it was actually written for women. The title is a little, like, I don't love the title, but it really worked for me. It's called Smart Women Finish Rich. And I was like, wow, this really speaks to me. So similarly, during the pandemic, not only did I start the podcast to start, elevating voices, amplifying people, also I started writing for mainstream outlets. Now, I had been fully brainwashed academic. I was a little slow on the uptake, but then I started publishing a lot in the medical literature, and many of those articles are on ultrasound and on medical education. I never thought that I could write an op-ed or write for these magazines like what I just named until in 2018, 2019, I was asked to be a founding member of TimesUp Healthcare. And some people may or may not know what TimesUp Healthcare is, but people are pretty familiar with the Me Too movement. And Me Too were the stories, the narratives of workplace disrespect and inequity. TimesUp Healthcare at the time was started to actually hold institutions accountable, help institutions do better. And I learned a lot of the literature out there about the lack of equity in medicine. And also, I met a huge number of inspiring women, mostly physicians, that were writing these op-eds, that were writing for these other outlets. So I was like, oh, we can do that? And, of course we can. So back to the pandemic, I thought it was time. It was time to start writing some of these articles to help people navigate the workplace better.
Mm. And specifically, it having moments of conversation go better, not have as much misunderstanding, right? In communicating with each other.
Well, I
Is-
think, MicroSkills, small action, big impact, we wrote it with 3 truths that take us throughout the whole book. One is that time is a currency and it can only be spent. So we want people to be intentional about how they spend their time and with whom they spend their time. The next is, and this ties in with what you were sharing about belonging and access, the second truth is that the world is not equal. And that, talks about how many books assume that you have wealth, that you have generational inheritance, that you have a network, that you have a pedigree, all these things that are assumed. A business book may say, well, go out and network, but they don't actually tell you how. So my co-author and I sought to write a book that actually literally takes the reader through the how-to. We call them critical actions. And also, to the best of our ability, we make no assumptions about where someone comes from, because we know the world is not equal. We know the starting line is not equal. But with these MicroSkills, we hope to level set so that we all finish at the same place.
Okay. Yeah. Well, it's great. And we'll be sharing the information and letting people know where they can find it. Um, when I look at kind of your whole life story and your journey, at the present time, you're teaching, speaking, writing, designing. We didn't even talk about healthcare design, hosting your own podcast. I want to, I ask this question often, what drives you? And I always feel that there is something behind um, people that are continually seeking new things and learnings and projects. So if you could, is there one thing that drives you in life?
You're right. I think that I have always had a lot of energy and ambition towards accomplishment and productivity. And if I were to tie it all together and all these things that may seem a little unrelated and disparate, for me they all tie together with trying to make a difference for people that don't have access, trying to leave the world a better place, trying to create something sustainable that'll help people live healthier lives.
So it's a desire to serve, I guess, right? To
Yeah.
serve others.
Yeah. I think, this is a bit of a well-known phrase, but I believe in it. And that's, with privilege comes responsibility. And I think, with becoming a physician, with having access to education, with having health, like all these things, I think that there is a responsibility to help in areas where there is need, to, exhibit kindness and gratitude towards people, to help people on a regular basis. I think, this is, our time on this earth is to, be together and not be going it alone, and nobody accomplishes anything alone. And I'm acutely aware of that. And I can tie that back even to those team sports that I played as a child.
Yeah. Okay, my last question is I'd love for you to share with a woman who's in our audience that perhaps is in a place in her life, career wise, where she's feeling like she doesn't belong there, wherever that is. Your book is full of tips and ideas, but what's one thing she could take away from this interview that she could try to implement right away?
Yeah. We have a whole chapter on networking, and I'm not going to talk about networking as the one thing, but I bring up networking to say that none of us are starting from network zero. If we've grown up in a family, if we went to elementary school and high school, we already have a network. We just may not appreciate it. But I'm not talking about the network in this case. I'm talking about what's related to the network, which is the personal board of directors, which I didn't come up with this term, personal board of directors, but I love the term. And some people are like, what are you talking about? And it's not a literal table, board table. It's a figurative. And it just implies that all of us need to have those go-to people, those people where you um, can speak and have, get things off your chest, people who can help guide you, people can, give you feedback, people can support you, the people you trust and have your best interest in mind. And again, we're talking about professional journey and workplace, and we're not, there's often an overlap with personal, but I'm talking about professionally. So to your question, I would encourage that person in the audience to number one, designate who is on my personal board of directors. Who do I call when I have an emergency? Who do I call to get things off my chest? Who always makes me feel better whenever I speak with them, or who gives me amazing advice? And one of the things we talk about with this personal board of directors is you may have someone that you call when you have questions about finances and taxes. And that may be someone different that you call when you're having sort of a conflict at work and you want to practice and role play a difficult conversation. But I would say, take a step back, take 2 deep breaths, and actually have conversations, interact with people on your board of directors to help give you perspective, to help you create something perhaps actionable, or sometimes to just sit with you and help you express and get it off your chest.
Yeah. I think that's such great advice because it helps you to do that with taking the emotion out of it, the reactionary emotions and, how you respond to something. So I think that's really, really good advice. Having people you can really be vulnerable with and they validate what you're going through.
Yeah. If I can add, as emergency physicians, we witness some horrible things and we have patients die. We have people who are very sick or have had very traumatic things happen. Sometimes we make errors, sometimes we don't make errors, but we fear we've made errors. And this is another term I didn't come up with, but there's a concept that's talked about called having a failure friend. The person you can call who will understand if you just want to talk about a patient case, no judgment, no ramifications, but just to really run it by them. It's often someone who's also in medicine, often in healthcare, who will understand the context. But I think, you don't have to be an emergency physician and have a failure friend, but that equivalent in every industry, like we all need help. We all fail, we all succeed, and we're all works in progress.
Yeah, absolutely. Great advice. Resa, thank you so much for taking time to be with me today and sharing your story.
Sue, it's a huge compliment to be invited. I'm so glad to be in conversation, and I look to you to help grow and see where a podcast can go. So congratulations to you.
Oh, thank you. Thank you. We're going to go into our last break, and I will be back to close out the show.
We are CHOP, and we can't wait to show you around. We're the nation's first children's hospital. Now, a care network with more than 50 locations that continues to expand. 3 state-of-the-art research buildings with 1.5 million square feet of space. We have grown from 12 beds 165 years ago to nearly 600 beds and one of the best children's hospitals in the world. We have a level 1 trauma center, 11 floors of patient units, more than 20 operating rooms, first of its kind delivery unit for babies with birth defects, a separate cardiac operative and catheterization suite, and places to learn, like our internationally recognized simulation center. We have trained generations of leaders in the field of pediatrics. We are world leaders in medicine, surgery, and science. One of the top recipients in NIH funding for pediatric research. In this building, pioneers in CAR T therapy, mitochondrial disease, brain tumors, hyperinsulinism, and other rare diseases. Here, groundbreaking work in fetal surgery, genetics and genomics, and neurology. In our newest building, leaders in social determinants of health, clinical informatics and epidemiology, autism, trauma and injury prevention. Our patients come from every state and 115 countries. Meeting these challenges requires the best and the brightest. We are passionate about pediatrics. We are motivated to make a difference in the world and in our community. We are a team. We are CHOP.
That's it, everyone, for another week of Women to Watch. Thank you so much for being with me. Next week, I'm going to be speaking to Cheryl Ecton, and Cheryl is the founder and CEO of Elite Building Services. Really interesting story. She started as a receptionist and now owns a company with over 550 employees. So we're looking forward to having her. If you are a fan of the video version of Women to Watch, you can find us, as you know, on YouTube, and we're now also on Spotify. Thanks so much to our sponsors and our watch team of corporate partners, and I hope you all have a great week.